morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. Had a couple strange things happen this week. I don't want to say strange things, but so we're entitled today, 2 Curveballs Nobody Warned You About. You know, what you don't know about Medicare can cost you thousands or leave you exposed. And so kind of what happened was, you know, one of the things I've talked about several times is we talk about the 40 quarters, which is the equivalent of working 10 years and then paying into the Social Security and Medicare system. Those that comes out of your FICA and your FICA taxes and your Social Security, you know, withholdings. So again, you can only get 4 credits a year because it's based on quarters of working. Now the good news there is, because it's basically equivalent of 10 years, but it doesn't have to be consecutive. So if you worked half a year and then you get laid off or got hurt or injured and unable to work for a year and a half and then you go back to work, that going back to work counts. What I think of a lot of times is you know, the ladies decide to be, you know, a full-time mother. Now, the good news is there, and I may be getting a little ahead of myself, but is you can qualify for credits based on a spouse. So we'll get into that in a little bit later. But those are some of the scenarios of where you might not have 40 quarters, or for whatever reason, you know, maybe you thought, well, I'm going to make my money, or maybe you worked overseas. You know, you could be working overseas. You're not taxed on income you earn overseas, so you could salt away a pretty nice nest egg. But if you don't have the 40 quarters, you're not eligible for Medicare, or you're not eligible for Social Security, and you're not eligible for premium-free Part A of Medicare. So that's the thing. That's where the costs kind of come in that if you're not getting that free, I shouldn't say free, that zero cost Medicare Part A, it can be very expensive. Now, one of the things is where it comes, if you're on an employer plan, you are still working, you can stay on that employer plan and delay Part A. There is going to be a penalty added to that Part A because you didn't get it when you turned 65. It's really fun. Actually, I may have to rethink that one. If you don't, here's how the penalty basically works, is if when you turn 65 and you don't enroll in Medicare, there are penalties for not enrolling on time. Now, if you have verifiable employer-based insurance, that will exempt you from the penalties. So if you're actually on an employer plan, you should be okay for not having Part A, because I tell people all the time, hey, you don't have Part A, you don't have to get Part A if you have your employer insurance. You can wait until, so maybe you are working because, and hopefully you have a job that provides employer-based insurance at that point, and you delay your Medicare because of that insurance. I believe that will still exempt you from the penalty for Part A. But the thing that gets some people is that if you don't sign up for Part A at 65 and you're not entitled to the premium-free Part A, then you can have a late penalty for not signing up, because if the reason you didn't sign up was to avoid paying the higher premium, that's how you get the penalty. Yeah, they double zap you that way. So anyway, here's what happens if you don't have that 40 quarters and you have to pay for Part A. If you have somewhere between 30 and 39 credits, then And this is 2026 numbers. So if you're listening to this show on a YouTube recording or your podcast recording, in another year, the numbers aren't going to be exact, but it still gives you a general idea. Currently here in 2026, if you have 30 to 39 quarters, it's $311 a month for your Part A. If you're under 30 quarters, it's $565. So that kind of makes it pretty expensive for a lot of people. So a lot of people will, maybe say, I'm just going to go without insurance. I can't afford that $500 and some dollars on top of everything else. And so they just don't bother to get Medicare. But there are still ways that you can be covered and not be on Medicare. Nothing says you have to be on Medicare, but you're also risking a lot if you're not. So that's kind of the catch-22, as they say. And then even though you're paying that high premium on Part A, you're still going to have that $1,736 Part A deductible for a hospitalization. And if you've listened to my show of any amount of time, that is not an annual deductible. It's what they call a benefit period deductible. So if you have a couple times in and out of the hospital during the year, you could have that $1,700 deductible, a couple times. And then, of course, your standard Part B premium is $202.90. Of course, now that can change with income. And lacking the Social Security quarters does not necessarily eliminate the Medicare need. The two systems are separate. There are some workarounds. I kind of alluded to this a little bit earlier, but I realized I wanted to go a little bit deeper into this before I started explaining. The spousal credits. And it could be a current or former spouse. If they qualify, you can use their credits, but you had to have been married for 10 or more years. But if that spouse had the 40 quarters, and this is where it comes into, like a lot of times, like I say, the ladies that decide to become a full-time mother, maybe they got married right out of high school, worked for a year or so, had a baby, and decided to stay home and never went back to work. They don't have they don't have the 40 quarters. They only worked a year or two paying into the system. So on their own, they may not qualify for Social Security and the premium-free Part A. But if they had a spouse, and it can be a former spouse, say they were married for 10 years or more, or maybe they were married for 40 years, that spouse passes away. Well, the spouse was working full-time during that time, so again, it qualifies. But even if you were divorced, you can use those credits, and it doesn't cost that the ex-spouse anything for that. So it's people think, well, I don't want her touching my Social Security. They can get it whether you want them to or not. but it doesn't affect your Social Security. So if you have a spouse or ex-spouse who's drawing their Social Security based on what you've earned and what your Social Security level is, they're not taking anything away from what you're receiving. So don't worry about that. So that's one of the workarounds. The other is, as I said, keep working. If you keep working, you're earning credits, and you also maybe could possibly have that job site-based, the employer-based insurance that exempts you from those penalties because you have legitimate employer insurance. So you can keep working to delay that. You do the math. We do this all the time when people are turning 65, whether they're going to go on Medicare or not, is doing the math to see if the employer plan still makes more sense. And especially the employer plan is probably going to make the most sense if you don't have your 40 quarters, because one, it can exempt you from the late penalty, and once you get your 40 quarters, you can then decide whether you're going to go on Medicare or continue on the employer insurance. So it does give you some help there. And then there's also, the Medicaid, what we call QMB, the Medicare Savings Programs. So if you qualify for those, generally the state will pay for your Part A and B. So those Medicare Savings Programs can be, of assistance there. And again, maybe you don't qualify for that, but you will qualify for the subsidy, the low-income subsidy for your Part D, the prescription coverage. If you qualify for that, you don't have the late penalty for Part D. It's not going to help you with late penalties for A or B if you don't qualify for the Medicare Savings Program. But again, you could have just a little bit more income and qualify for that other. So that's kind of what's the situation there. And I mentioned, because like say you worked overseas, people don't file income tax generally don't file income tax on their foreign earnings. So they maybe you stayed did 3 years in the Army or 4 years, if you're boomer age like us, where we had all, millions of service members in Europe because of the Cold War, a lot of those guys, I say guys, I mean, there's some gals that did too, but most of the guys would marry a local girl and decided to stay in country when their enlistment was up and got a job. And sometimes they'd work for a contractor with the U.S. government. But again, they're working on foreign soil, so they're not taxing it. So they could build up a pretty nice nest egg, and in their later years, decide to move back to the States. And especially now with the downsizing of our military in Europe, the job that you had maybe doesn't exist anymore. So now you're moving back to states, but you don't have your 40 quarters because you've been earning your income overseas. You're still entitled to Medicare because you are a citizen. You're turning 65, but you may have to pay those higher premiums. So that's kind of what came up with a client that I'm working with, has money in the investments, is living off investments that doesn't have the 40 quarters. So actually right now is on the marketplace getting a subsidy based on currently the only income right now is the income from the investment. So figures a pretty good nest egg if the investments are generating enough income have enough income to get the tax subsidy from the marketplace. So one of the things I used to say this, I used to say it wrong. I'd tell me, oh, you're turning 65, you lose your subsidy, you have to go on Medicare. It's not exactly true. It's mostly true, but if you do not qualify for premium free or zero see, I said free again, no cost premium free Part A, you can stay on the marketplace and still be eligible for the subsidy. Doesn't exempt you from the penalties. And in fact, the Part D penalty, in most cases, it will suffice, but the policy has to be considered creditable. And so depending how that marketplace plan treats prescriptions can determine it may or may not be creditable for Part D. Now, the Part D penalty, that one's not huge. But again, when you're adding on penalties, you're just adding another one on. That maybe not so great. So that's some of the costs we'll look at on that. So those are some of the things that hit that on those costs when it comes to not qualifying for premium free Part A. So you may delay Medicare, and I'll talk a little bit more about the costs. We're actually coming up here on the break, so I want to talk a little bit more about those costs, and then I've got another scenario that came up this week that I want to address. So we're going to go to our commercial break now, and we'll be right back. We'll talk a little bit more about these costs, and then the other curveball that got thrown to me this week.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
Your home is more than four walls. It's where your family feels safe. Twin Lakes Security helps keep it that way. Discover the most popular home security products: smart home panels with face recognition and live camera feeds, smart smoke detectors, indoor and outdoor cameras, and a video doorbell so you always know who's there. Watch live, get instant alerts, even unlock the door from your phone. It's all backed by a friendly support team based right here in the Upper Cumberland. For a free quote, call 931-528-2005 or visit twinlakes.net. Twin Lakes Security made simple. TN certain receipt -0026.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we are back with Insurance Matchmaking. And before the break there, I was talking about, if you're just tuning in, had a scenario, got a curveball thrown to me this week. I've got a client who doesn't qualify for premium-free Part A because he does not have the 40 quarters or 10 years of paying into the system. And is on the marketplace. So, and I wish I should have brought those figures with me today, but did some calculations. Had ChatGPT, of course, help me figure out, okay, based on the cost now, and if you delayed, say 5 years from now, he decides to go ahead and go on Medicare, then when you add in the late penalties and the paying the higher premiums at the time, and of course, the calculations ended up being based on this year's rates, so some of the numbers come in a little low. But basically, the amount saved by not paying, because I think he has less than the 30 credits, so it would actually be the $565 a month for Part A. So you add in Part A and the Part B, and then add in a cost for a Medicare supplement and all those other things you add in that. If you waited 5 years, even with the penalties, the savings for not paying the higher premium for Part A right now would actually save income, or not save income, but the expenses would be less from the 5 years than if he went ahead and went Medicare now. So it's really kind of weird how the calculations work, because there is a late penalty for Part A, and I should have had those numbers in front of me. I'm sorry. Maybe I'll address that in another show. But the penalty on Part A is you have the penalty for twice the time that you didn't have Part A. So if you went 5 years without it, you're going to have the penalty for 10 years, and then it goes away. Part D and Part B penalties do not go away on time. They continue. And the Part B premium is 10% for every year that you didn't have. 10% of the current Part B premium for every year that you didn't have Part B and should have. And then Part D is based on months, and it's a formula, but it's 1% times the formula times the number of months that you didn't have Part D and is determined that you should have. So that's what I'm saying. It could help possibly, at least it would help a little bit on the Part D if the Marketplace plan is considered creditable coverage for that. And the other thing we talk about the creditable coverage is you could have an employer plan, but if there's less than 20 employees, you could still be subject to some of the penalties because Medicare is still primary if you have a small employer. So if you have a large employer and they're primary, then you don't have penalties. And it gets a little sticky about whether you have penalties or not, but you may not have the penalties because you have creditable coverage because you have employer coverage, but you could still be out a lot of expenses because your employer insurance may not pay because Medicare should be primary. So if you don't have Medicare and should have, your employer plan may not cover you either. So those are some other considerations taken into it. And again, that's something, get with us, give us a call, sit down with us. There's no charge for a consultation regarding your Medicare. I do it all the time. It's like talking about it, I'm using an actual client example on this. So he and I have been going back and forth a little bit lately on it, on some of these scenarios. I've been doing some research, so it turned out to be some good show research. But if I can help you, I'm going to, and hopefully, I'll get some business out of it, but not always. But if I help somebody, that's payment also. Usually when I help somebody, maybe they don't do anything with me, they end up becoming a very good referral source. So, if you got somebody that's in one of these, in a similar situation, have them give me a call and we'll see if we can't figure something out for you. The other thing is, and one of the things I've been working on for my client is to try to find maybe some substitutes on the insurance, because I'm always concerned with the Marketplace, the subsidy based on income, or rules could change and he could end up not eligible for the Marketplace anymore because he should be on Medicare. They could change the rules. Right now, in the subsidy there is based on income. They don't look at your assets to determine whether you qualify for the subsidy or not. Whereas like with Medicare plans, a lot of that stuff will look, and some of those, not just Medicare plans, but some of the assistance that you can receive are not just based on income, they're also based on assets. So you may have a very low income, but because you have assets that could be liquidated to pay for your medical costs, you don't qualify for some of the things that are subsidized, like that low income subsidy for Part D. So that could change. Right now, the Marketplace does not look at your assets to determine whether you're eligible for a subsidy. It's only based on income. So, you could have $2 million in the bank and have no actual income and not qualify for a subsidy at all, or or still qualify for a subsidy because what constitutes income, what goes on your income tax, qualifies you for the subsidy. So those are some things that could work there. But looking at some things like life insurance that has, a chronic or critical care rider that you can take up to, say, 80% of the death benefit to if you have a catastrophic event. And then a lot of the stuff you've heard me talk about, the umbrella coverage we're doing with the Medicare, those are not tied to whether you qualify for Medicare or not. We pair them with Medicare, but you don't have to have Medicare to have those plans. So there are some things you can take. Again, insurance is the exchange of risk. These aren't health care plans I'm talking about. These are insurance that would pay out if you have a catastrophic event, so you don't deplete all your savings. So whether you're not eligible for Medicare or not, these are the plans we recommend, because we recommend that you protect yourself. It's just like, we don't recommend you drive your car without car insurance, and and the bank won't let you buy a house and carry a mortgage on it without having homeowners insurance, because they're going to protect their interests, but they're making you pay for it. That's part of life. So I have a lot of plans out there that can help you hedge your maybe not the right term, hedge your bets against having those catastrophic expenses. So those are things we really want to be sure we can help you with. And some of the plans are they're easy, simplified, easy underwriting, that are forgiving of not having perfect health. I mean, certain things we call them our knockouts, but there are a lot of things that you'd think, I can't get the insurance because I'm a type 2 diabetic now, or I put on a few pounds over the year, I'm not going to be able to get. And that's not necessarily true. And some of the plans we have are guaranteed issue. I have one carrier out there that has a hospital indemnity plan that it is guaranteed issue from age 60 to age 79. Now, of course, anything that's guaranteed issue, there's going to be some limitations. So like with this the hospital indemnity, well, yeah, it is a hospital indemnity plan. There's some we call the copay protection plans when it pairs with Medicare. But you can get that plan. You can max out the benefits on it. Now, there's going to be limitations for pre-existing condition, but generally those pre-existing condition limitations are a waiting period, 6 to 12 months. After that, it would pay out if you have those instances. So that's something that can be very handy. They're very inexpensive, and as of yet, I haven't seen any of them raise their premiums. So we can't say they won't. We talk about locking in the premium because they haven't raised them. They do reserve the right to raise their premiums. Maybe they've been having some other expenses, more payouts on some of their other plans, and they decide, you know what, we need to raise the rate. Well, if they raise the rate, they have to raise it on everybody. They're not going to raise it because you had a lot of claims. That's why we say, so you can lock in that rate based on your age. So if you get it at age 60, and you don't have to be, it's guaranteed issue, you can get it before age 60, but it's not, you have to answer health questions then. But at age 60 and up, hey, to up to age 79, and it doesn't, in fact, there's even a cancer rider that doesn't even ask if you have cancer right now. It just doesn't ask the question. Now, if you have cancer, it's not going to pay out for that cancer, but generally, most of the time, cancer plans we have, I can't sell you a plan if you recently had cancer or are being treated for cancer. This one, you can get it. It's limited. It's not going to have as much payout. But if you get diagnosed with cancer at a later date, it will pay because it's another diagnosis of cancer. It's not the cancer you had when you got the plan. So those are some things to consider. You can still have some protection. It's not real expensive. So, check on that. So anything was issue I had writing a marketplace alternative plan for an individual, and I probably have messed up on some of my applications over the years. I hope I haven't, but it asks, one of the questions it asks about is joint replacement. Well, I've always been interpreting that as the doctor's recommending that you have joint replacement or, in the next year or two. And I've been reading that wrong. It actually is a knockout, as we call them, if you have had a joint replacement in the past 5 years. Now, I can kind of understand some of the process of why joint replacement could be a knockout condition, because you may have, it may be because of certain arthritis conditions. That the arthritis condition really is what's knocking you out, but the joint replacement is the easy, you had your knee replaced 2 years ago. Sorry, you can't get this policy. Had a knee replacement 6 years ago and haven't been having problems with your other joints, you can get the policy. That's the part that kind of bugs me about the plan, is joint replacement's a knockout, but not if you've had it for over 6 years or over 5 years. And I get that because they figure, okay, you're not going to run into an issue with that needing to be replaced. Well, the thing is, there's already a clause in the policy that the policy won't cover joint replacement. with one exception. The necessity of replacing the joint is a result of an accident. Say you're in a car accident, you get your knee shattered. Okay, you may have to replace the joint. It will pay for that. But your arthritis is flaring up and you decide it's time to replace the other knee, you're on your own. So that's when people say, okay, well, it makes sense to go ahead and put that surgery off until I can get on the Marketplace or go on Medicare, and then the insurance will cover it. So that's some of the things there. But so I've got a client that I thought I had a great plan for them. You've heard me talk about that medical expense shield. Well, part of that plan is the short-term health, and the short-term health knocks out that joint replacement. So I'm going to have to come up with a solution. And unfortunately, I think the solution is going to end up being that the individual needs to go on the Marketplace with no subsidy, and the rest of the family stay on the other plan. That's going to be the most cost effective. They may elect all three go on Marketplace, which that might be the right thing for them. It's really going to zap my commission, because the other plan, which was saving them more than 50% of what they'd pay for the least expensive plan on the Marketplace, I get paid a commission on the premium, not the $20 a month per member. So I'm going to do the right thing, but I wish it had, the situation hadn't arisen. I'm glad we caught it now, because it could have been an issue down the road. And because I did have a client a few years ago that had a procedure that I didn't understand what the procedure was, and that procedure was actually caused by a knockout condition. The health questions were very simple on the plan. Hey, have you had done this? Have you done that? Done that? Nope. Issued the policy. She ended up needing a minor, I say surgical procedure. I guess that's the best way, but a procedure, not very extensive. And well, this company, once you filed claim, that's when they decided to look at your medical records. Because some plans I'd fill out an application and it gets declined because the company pulls their medical information board or their script. But anyway, and they'll turn it down based on the research that the company does. This company didn't do any research prior to issuing a plan, but they can, once they find out that you shouldn't have been issued the plan because of a pre-existing condition that was a knockout, they don't take you to court, they don't sue you, they don't, you're not going to jail, but they will cancel your insurance. They'll refund your premium, which is interesting because you haven't claimed anything, but that's all they do. And now you don't have insurance, and now you have to have this procedure. So we don't want that to happen. So we need to figure out what's going to be the solution for this client. And I've ran over the time. So until next week, stay tuned here on Grace 107.7 and tune in to Insurance Matchmaking. Please go to insurancematchmaking.com and check out the YouTube, the past shows, and please subscribe and like and share those. And we'll talk again next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.